Good morning everyone. Today we are going to have a presentation on working with diverse people. I have my friend Kylie here and my friend Kessler. Are you consenting to be part of this presentation today?
Yes.
Yes, I am.
Beautiful. Okay, so in regards to our presentation today, it's working with diverse people. We'll be covering three topics: the needs of Aboriginal and Torres Strait Islander people, issues arising from language barriers, and issues arising from transgender people. Here you can see that there are been quite a few challenges for Aboriginal people within the healthcare sector. Some of these are socio-economic, political and cultural challenges. They have sometimes limited access to healthcare, healthy food and safe housing, and impacts on chronic diseases, and their life expectancy is different. The social impact is there's isolation due to social differences, community connectedness and clashing family attitudes and values. There are economic impacts, difficulty assessing services, limited access to higher paying jobs. There are incentives that the government have brought out in regards to closing the gap framework and the Medicare benefit schemes. The initiatives to improve healthcare, this 715 health checks, chronic disease management plans, providing affordable medications for Aboriginal and Torres Strait Islanders, and mental health programs also recognising historical traumas. As I said, there are national health plans for the National and Torres Strait Islander focus on education and employment and enhancing their social and health outcomes. Cultural factors in the healthcare that Aboriginals do face are the healthcare worker cultural insensitivity, the impact of miscommunication and mistrust, delayed or avoided medical care. Aboriginal people avoid eye contact with a high authority as a sign of respect. So there's certain barriers, also language barriers as in medical consultations as well. Challenges in assessing services. Sometimes there are the cultural isolations, especially out in more rural areas, and difficulty in understanding the Australian cultural norms that they're not used to. There are legal protections for Aboriginal people. You've got the Racial Discrimination Act, Australian Human Rights Act and Anti-Discrimination Act. There is discrimination, harassment, discrimination in employment and housing, harassment based on race in and outside of work, disregarding traditional remedies. So these are some of the things that Aboriginal people do still face today in our modern society. We can practice inclusiveness, and there's strategies involved that you can hone in on with cultural safety and training for hiring staff, hiring Indigenous workers, acknowledging Indigenous land, and partnerships with Indigenous health services.